Vaccine fatigue is really not my research topic of interest. So do pardon me if my presentations is a little bit tardy and incomplete. But this topic certainly is very, very close to the heart of many of the clinicians. Well, by the way, I'm an adult infectious disease clinician as well as a public health person. So from my very limited search, I tried to understand a little bit about some of the terminology. Vaccine fatigue, in fact, is something very new to me. This is a new terminology to me. That is people's inertia or inactions towards vaccine information or instructions due to perceived burdens and burnt out. I think this is very closely related to the very recent pandemic event, this COVID-19. And vaccine hesitancy, this is the terms that we have been using it for quite a long time. It is not totally a vaccine refusal, but it could be a delay in actions, or it may completely refuse to be the recipients of the vaccine. It is not static. It is dynamic and it is very contextualized to certain situations. And it can be influenced by many factors. I think this morning we heard a lot of the very good suggestions in terms of how we can overcome vaccine hesitancy. Anti-vaxxers, however, is very different. It is someone that is opposing to receive vaccines, and not only that, they will also influence others in terms of their concept of vaccines, in terms of the negativities towards vaccine. And this is another new term, which is vaccine overload, and I think it is very, very relevant to today's vaccine practice because we are pushing out more and more vaccines, and this is practically a non-medical terms, but it is just how we handle all these vaccines that is going to come out and how are we going to utilize it. And sometimes many of our patients also express there's just too many. So what I've done with my limited experience in the field, basically try to look at the social media and try to understand in a qualitative term how people look at vaccinations today, particularly in relations to COVID and influenza vaccines. Now, I just take up a few which I think it is relevant for our understandings and also perhaps for us to reflect in terms of how would we want to have vaccine campaign and to introduce vaccines in the future. So effectively, after 3 years of non-stop talking about the virus, which is COVID, and vaccinations, and there's certain degree of burnout. I think it's not just the people, common people, but I think even to the clinician as well. And a lot of it is also misinformations about vaccine safety, and this is one of the critical elements. A lot of it also feel that politicizing of COVID-19 vaccines actually amplify a lot of the unfounded fears. When you have a lot of information telling you that it's very safe, I think in the back of the people's mind, they may feel that it's actually unsafe. Otherwise, you don't have to really emphasize a lot about safety. And I think the part of it is that the vaccines may not completely prevent you from infections. And that's always the point that my patients told me. You can't prevent infections, and why do I need to take the vaccine? And there's a lot of all this that we have to encounter and handle as a clinicians. And many of them, I think today, even for COVID, you might feel that it's really a non-issue. It's a mild conditions. Why should I continue to receive COVID vaccine? And I think to many of the clinicians, the patients also will feedback that post-vaccinations, many of them also experience side effect. And I think not uncommonly, many of them express that having the mRNA vaccines tends to have more side effect because of the immunogenicity. So they do not want something to make them sick while, they perhaps will not come down with the disease. And here is that we know that during the last winter times, a lot of fear about this twin pandemic, having influenza as well as COVID, and there was a lot of people willing to go for it. But in the end of it, it turns out to be relatively quite all right, quite mild. So there's another concept of people need to be able to understand why do they want to go for it, where it turned out to be something that is relatively mild in nature. And the worst part of it is that when we deliver the vaccines and we recommend it to our patients, at the end of it, the disease turned out to be something very different and the protections may not be perfect or complete. Then it becomes very difficult for the clinicians subsequently to be able to convince our patients to have further vaccination. And I think at the end of it, to many of patients, perhaps, we ask them to go for this and that. It's truly a decision fatigue. This vaccine and that vaccines to them may be a bit difficult for them to handle. Now, the first point I want to mention here in this slide is that we recommend influenza vaccines and we also recommend COVID vaccines. So that's what I've been telling my patients. Well, we are given 2 arms. You can have 1 arm each. And now we're going to introduce RSV vaccine. So I told them perhaps, another site, maybe your buttocks, we had 3 sites to receive the vaccine. So there's a lot of convincing work that we need to put in to have our patients be ready to accept the co-administrations of the vaccine. And to many of the clinicians, we just don't have the time because, your clinic sessions, you may have to handle 10, 20 cases. You just don't have time to look at their regular conditions, regular disease, plus having these long conversations with the patients in order to convince them to have the vaccination done. So in general, I think I didn't move this, yeah. So in general, it's really a difficult task on the ground for the clinician as well to be able to interact with our patients in promoting research, promoting the vaccinations. Now, I just want to mention here that without a good vaccination coverage, and I think the R0 of the COVID today is possibly higher than chickenpox and possibly closer to measles, and we really need a very high vaccine coverage rate to have the community protections. So this is one of the articles that I found which look into the determinants of the vaccine fatigues. In fact, there's not a lot of literature. So if any of you can find something else, and I think happy for you to share and enhance today's discussion. So this is a study published in Nature Medicines just this year, and it's a cross-sectional survey looking at combinations of different determinants, and they did a survey in 2 European countries, in Austria as well as Italy, involving more than 6,000 participants, 14 and above, and they have 3 different types of vaccines recipients. One group totally without any vaccinations, second group that just received those ones and those 2, and the third group of patients received more than 3. So they have the abilities to compare different countries as well as different level of vaccine acceptance. It's a very busy slide, so I will just quickly show you those that I mark out with very significant differences. So let's look at the one in the bottoms. I just want to point out here that it's just a minimal increase in price of 20 euro. You can completely sway your participants towards very negative effects. So in other words, they will totally say no to the vaccinations. Now this is 2 slides here, 2 sides. On your left side is basically looking at binary choice, and the other side showing you a scale from 0 to 10. And the significant finding here would be if you have a new vaccines that is adapted to the new variant, the likelihood that people would want to go for it. And if you have a small increase in price, I'm sorry, likely it's not going to have people willing to go for the next round of vaccination. So similarly, this is another way of looking at it. Again, you can see that having a little bit of price hike is going to turn people away. But the important thing here to also mention is that the other arrow that's at the bottom showing you community spirit. So in other words, if the campaign focus is not on the individuals, but on how these individuals can assist to bring down the transmissions or protect their loved one in the community, the likelihood that you'll be able to move those non-vaccine recipients that is marked in red. So let me just quickly run through some of the key findings here. it is essentially showing the difference in terms of the triple vaccinated versus the non-vaccinated. The triple vaccinated is more likely to continue to want to be vaccinated. I think that is quite a given. The unvaccinated group, actually, they are not really concerned about the benefit of having the vaccine. They are more concerned about the safety. Whereas those people who want to go for the vaccines, they are more concerned the benefit rather than safety. And in these experiments, I just quickly, in a limit of time, just to quickly summarize a few things that, again, we are looking into incentive, whether incentive can mobilize people. In this particular study, you can see that even with incentive for 500 euros per injections, you could hardly move the needle. So in other words, incentive may not be something that that particular countries with that situations would want to have much of it in the campaign. However, and I mentioned earlier on, the sense of community spirits likely is going to help with that. Now, this is another experiment looking at the media communications, how we run the campaign. And again, you can just look at the arrow. For those individuals that likely to respond to the campaign would be utilizations of celebrity to endorse, particularly having a celebrities to say that somehow they missed the vaccines, they came down with severe disease, and that can become a very powerful message to mobilize people to consider going for vaccinations. And lastly, from here you can see that those when the legal part kick in, that you impose a fine for people that not going for vaccinations, you can have a very, very negative impact. And again, I'm going to move fast forward, but I just want to point out to the first point here, that is the consensus among physicians is going to be critically important in terms of the communications and the campaign. So in other words, if you have clinicians that disagree with one another, then likelihood that the persons, the communities, the publics would not want to go for the vaccinations. Now I'm going to move fast forward to that, just to show you that this is a very interesting thing that I found in the media. And this is experience in Canada, looking at whether incentive can mobilize people to go for vaccinations. So you can see from here, the yellow line represents people who receive only one dose, and the top wavy line showing you people who went for 2 doses. And then what they have implemented is to give lottery tickets as the incentive. And you can see from here, basically it did not move at all. So no matter what you do, people with 1 dose continue to be very low in acceptance, and people with 2 doses basically didn't show any significant impact over here. This may differ because different countries may face different kind of issues. Some countries, you may see that this perhaps is one of the way they can mobilize the communities to go for vaccinations, because they understand even in the Asian countries, we also utilize some of these incentive measures. Vaccine passport as well as vaccine differentiated measure. In the Singapore context, we use quite a fair bit of vaccine differentiated measures. So in other words, without vaccinations, we may limit the accessibility to certain common area. For example, food area, we all need to eat, we need to have leisures, and without the vaccinations, you may not be able to enter into these locations. And also travel restrictions, I think, is something very common. Well, this may work during pandemic, but I do not think that this likely will continue to be able to sustain in the post-pandemic period that is now. So let me just quickly summarize in terms of a few key points and the lesson learned from the study looking at the determinants of the vaccine fatigues. Campaigns messages conveying a sense of community and emphasize the need to hold together to overcome the crisis, in fact, is one of the very important effective measure. Having the legal rule in will negatively impact many of the vaccines, and it also erode the trust It is important then for us to look into how we can improve and promote trust in the institutions. And I think we need to deal with currently a lot of misinformations, a lot of rumor and conspiracy theories about the vaccines. So when we give incentive, I think it's quite important because a small amount is not going to move the needle very much. And a little bit increase in the vaccination fees may completely deter your populations from having the vaccination. And it's important to also mobilize the professional, the medical consensus, and also good to engage celebrity for them to be the persons to endorse the vaccinations. And in a Singapore context, we also use a lot of politicians as the celebrity endorsement. So I think it's important now looking at this data because most of us in most part of the world, we have very high level of hybrid immunity, 3 doses plus natural infections. So I think it's important to extract the information from here and be able to target on these populations because that is the current majority. Lastly, I just want to share with you the XBB vaccines, the monovalent vaccines is available in Singapore. And this is a recommendation from the MOH, recommending older individuals, vulnerable individuals to utilize the monovalent vaccine. And certainly I hope that this morning you have heard from some of my colleagues in terms of the measures they put in place. Hopefully this year ends will be truly a litmus test to the Singapore situations in terms of how many people will now take up influenza vaccines near year end as well as COVID-19 vaccine. I just want to thank my entire crew member, the teams in the National Center for Infectious Disease, and putting our effort together riding through the COVID pandemic. Thank you.
Thank you. We've got time for 2 questions. We've got a microphone over here. And just while we're waiting for that, online we've got a question about the dialogue between physicians. So transparency means you'd like physicians to be talking about the benefits, the costs, the risks, the safety. But you mentioned there that if there's disagreement, which we would see in the scientific community as good discussion, translates into skepticism and conspiracy theories. Just quickly, what's the way to manage that?
Yes. We are very fortunate in terms of the local Singapore community, where our clinicians, infectious disease physicians play a significant part in terms of bringing the information about COVID to the community as well as the vaccinations. We have not really seen a lot of disagreement among us. However, I agree with you because the Singaporeans have very high literacy rate, and many of them do surf internets, and many of them will explore, look for informations. So there's a lot of misinformations out there. Even for the highly educated people, you'll be surprised what kind of misinformations they also produce. And therefore, I think it's quite important in terms of continuous discussions and information sharing from reliable source. And reliable source in different countries may be quite different from the Singapore local situations. A lot of it from the higher level politicians as well as professional bodies.
And final question from the floor here, thank you.
Thank you, Prof. Leo, for your wonderful presentation. My name is Hindra Irawan Satari from Indonesia. Just want to ask you one question regarding your national immunization program on COVID, against COVID. You know, Indonesia already give inactivated vaccine COVID more than 450 million doses in Indonesia during 3 years. And I saw in your slide that your government not included the inactivated vaccine in national immunization program. Maybe you can explain us what is the reason or information. Thank you.
Why the inactivated vaccine is not so commonly used in Singapore?
I saw your national guideline recommendation.
Oh, yes. Yes.
In Singapore, right?
Yes.
That's it.
Yeah. So I think the question is why the inactivated vaccines is not really in there and not very commonly used. Basically because when we need to make a choice, we have the concept of making it simple, because then your scheduling and your vaccination center will be able to structure it in a more efficient way, rather than having too many different combinations and too many different schedule. So we make a decisions right from the start that we will emphasize a lot on mRNA vaccine. And subsequently, we did the study to compare mRNA vaccines versus the inactivated vaccines. And we realized that for the inactivated vaccines, you need to at least receive 3 doses to be comparable in terms of the antibody productions compared to mRNA vaccine. And so it's not totally not in use in Singapore for the inactivated vaccine, but the scheduling is different. And currently, we basically emphasize a lot on mRNA vaccines and the recombinant vaccine.
Thank you, Raja. Thank you very much.